So here's an old lady slipped and fell at home and had a Colles fracture. Now managed with POP cast, they are asking what is the correct sequence of reduction when we apply the POP cast. So here the patient is having Colles fracture. Now Colles fracture means it's a fracture of the distal end of the radius. So distal end of radius, that is the metaphyseal fracture. Now when we talk about distal end of the radius fracture, we have four fractures. Two of them are extra articular fracture and two of them are intra articular fracture. Extra articular fracture are your Colles fracture and your Smith's fracture. Intra articular fracture, you have Barton's fracture and Schoffer's fracture. Barton's fracture and Schoffer's fracture. Now, Colles fracture or Smith's fracture. So, depending on the fractured segment which is dislocated dorsally or ventrally, we can identify whether it is a Colles fracture or Smith's fracture. So, supposing this is the distal end of the radius. This is the distal end of the radius. Now this distal end of the radius is having a concavity here, and this concavity is always towards the palmar side. Okay, this concavity is always towards the palmar side. So when we take the lateral film of our hand, this will look like this. Okay, and this is the palmar side and this is the dorsal side. So it will always point towards the palmar side. Okay, and our thumb is always, when we take the lateral film x-ray, you can see the thumb is always separated from the other fingers. The thumb is separated from the other fingers and thumb is always towards the palmar side in the x-ray film. So this is the thumb, and by that we can identify whether this concavity is towards the palmar side or not, because if thumb shadow is there, okay, and this concavity is towards the thumb shadow, that means this is towards the palmar side, and palmar side is your ventral side, dorsal side your this side. Okay, now supposing there is a fracture here, this is extra articular obviously because the fracture line is not going through the intra articular joint line means the articular surface that is of the distal end of the radius with the carpal bone that forms the wrist joint. We know ulna is not participating in the wrist joint formation. So here this is fractured. Now this is the fractured segment, this is the distal segment and this is the proximal segment. Now depending on whether this distal segment is going distally, means dislocating distally, is what is your what is your Colles fracture, C के बाद D आता है, so that is Colles fracture, or whether this is dislocating proximally or rather ventrally, is what is your Smith's fracture. Okay, understanding? So there is a fracture line which is passing not through the intraarticular space, passing just through the metaphysis. Okay, and if this is dislocated and dislocated towards the ventral side, it is your Smith's fracture. If dislocated dorsally, it is your Colles fracture. We'll be understanding it with more diagrams. Okay, Barton's fracture means when this is going and involving the articular surface. When this is involving the articular surface is what is your Barton's fracture. Now this Barton's fracture may be ventral or dorsal depending on the fractured segment going dorsally or ventrally dislocated. So same like your Colles and Smith's, but here the fracture line passing through the articular surface. And your Schoffer's fracture is something which actually involve the radial styloid process only. So it is basically your separation, or rather you can say isolated radial styloid fracture. This is chauffer. Chauffeurs are the drivers in French who used to use a particular type of handle to start their engines of car, and because of the repeated trauma by the handle, the radial styloid process gets fractured after all. Okay, so if you see, this is the broader bone on the distal wrist x-ray. The broader bone is your radius. So this radius, and you see this isolated radial styloid fracture is what is your Schoffer's fracture. Okay, now please understand these two x-ray films. Okay, see, this is what is your fracture line passing through. This is what is your fracture line passing through the metaphysis or distal end of the radius, not involving the articular surface, same as here also. Okay, so either it may be Colles fracture or Smith's fracture. Now what I have to understand is what the where this distal fracture segment is dislocating, either ventrally or dorsally. Ventrally means towards the palmar side, dorsally means towards the dorsum of the hand. So I told you ventral or palmar side is denoted by this separated metacarpal shadow, that is the first metacarpal is for the thumb. So thumb shadow means it is towards the ventral side. Now this is my concavity, you can see, and this concavity, if you draw a perpendicular line, it is denoting towards the dorsum. That means this distal segment is actually displaced dorsally. Okay, if you see here, this is the distal segment. Okay, this is the fractured segment, and this is where you draw the perpendicular line, and here you see towards the thumb, as I have already marked the thumb shadow, it is towards the thumb shadow. It is always the ventral or palmar side, this is the dorsal side. Okay, this is the dorsal side, this is the palmar side. These two are opposite hand x-rays, so you might think both are towards the same side, but these are two opposite hand x-ray. This is left, this is right. Okay, so just forget that, you just identify the thumb shadow from here. Okay, this is thumb shadow here, that means this is the palmar side, and draw a perpendicular line from the concavity here. It is going away from the palmar side, means dorsal displacement. Dorsal displacement means CED, Colles fracture, dorsally displaced. Okay, and D for Dinar fork deformity, D for Dinar fork deformity. Okay, now here you see dorsal, here is the thumb shadow, that is ventrally, and this distal segment ka perpendicular line towards the palmar side, so it is ventral. So it is a Smith's fracture, and Smith's fracture gives rise a garden spade deformity. Garden spade deformity, we will be learning this thing again here. Now see here, this is Schoffer's fracture. Here you see extra-articular fracture, intra-articular fracture. You see here the fracture line passing not through the intra-articular space. Here the fracture line is passing through the intra-articular through the intra-articular region. So this is Barton fracture, depending on whether it is going dorsally shifted, dorsally displaced is the dorsal Barton, whether it is ventrally displaced is the volar Barton or reverse Barton. Okay, here is your fracture line passing not through the articular region, so dorsally placed is Colles fracture, ventrally displaced is your reverse Colles fracture. Smith's fracture is also known as reverse Colles fracture. Okay, so now let us understand further. Okay, so as I have already told, this Colles extra-articular, and this extra-articular fracture is your Colles and Smith. Colles may you will be having dorsal displacement, you see this is dorsally displaced, and Smith's is extra-articular ventrally displaced. Okay, this is ventrally displaced. Okay, then I told you intra-articular, you have Barton's fracture, Schoffer's fracture. In Barton's fracture I told you that is intra-articular fracture is there, and Schoffer's fracture I told you it's an isolated radial styloid fracture. Now in Barton's fracture, please remember, not only there is just intra-articular fracture, there is very important thing, that is carpal bone subluxation. Because I told you when this joint is involved, please remember, when this joint is involved, this joint is actually articulating with scaphoid and lunate to form the wrist joint. So when this fracture line is passing through this intra-articular region, it will dislocate the carpal bone too, so leading to carpal subluxation, which will be typically absent in case of Colles fracture and Smith's fracture, because they are not going to involve your intra-articular region. Okay, so understanding the Colles fracture further, fracture of the distal end of the radius, is it true? Yes, cortico-cancellous junction extra-articular fracture. So it is cortico-cancellous junction, that means here in the metaphysis. Okay, yes, it is common in elderly post-menopausal women. That is very important. They might formulate a clinical scenario starting with a post-menopausal woman itself. Okay, The mechanism of fall for both of them, all of them, is your fall in outstretched hand. You can see from this image. Now this is very important, this is very important, and you have to understand this, because depending on this displaced fragment, okay, our pop cast, the techniques, the procedures, how we are going to place the pop, the step by step approach will be understood properly. Okay, so displacement of the distal fragment, ये जो distal fragment हुआ, after getting after the fracture, this is going to be displaced, might be impacted with where it is. So impaction is the most important displacement that happens. Okay, the distal fragment, okay, may be impacted, or it may be dorsal tilted, that means it may go dorsally, or it may go laterally or radial shifting, it may go radially. Okay, next, so depending on that, our pop cast, when we will be manipulating the hand for during application of the pop cast, we'll be understanding the various steps why they are being followed. Okay, so the treatment is, as I told you, Coley's cast, which is also known as hand shaking cast. Okay, remember, hand shaking cast, where we use glass holding cast. Glass holding cast is used in case of scaphoid fracture. The patient will be typically presented with anatomical snub box pain. Okay, anatomical snub box pain, pain in the anatomical snub box region. Okay, so hand shaking cast, and the steps are, you can see, pronation, ulnar deviation, and palmar flexion of the wrist. Okay, now why we are doing pronation? See, we are doing pronation because there is dorsal tilt. Okay, so dorsal tilt is there, so we are doing pronation. Then we are doing ulnar deviation because there is radial tilt, so we are doing ulnar deviation. And then palmar flexion, why we are doing palmar flexion? Because there is dorsal tilt. Okay, and we are also providing counter traction, traction and counter traction, so to take care of this impaction. Okay, so further going ahead, you can see here that one person is applying the traction, another person is applying the counter traction, and because of that we are taking care of the impaction. After that, the hand will be pronated. So once we are doing pronation, then we will be doing palmar flexion. Palmar flexion means we to take care of the dorsal tilt, and then we will be pressing it, doing a radial deviation to correct the ulnar tilt. Understanding? So this is what you have to be remembering. So first you are doing pronation, and then we are doing palmar flexion, and then we are doing ulnar deviation. So this is the sequence, and obviously you have to do it under traction and counter traction. नहीं तो the fragment will be impacted, will remain impacted, and this technique of reduction will fail. Okay, always remember this pop application is below the elbow. Okay, because below the elbow is done to prevent the stiffness at the elbow. What are the complications of this pop cast? Number one is the stiffness. Please remember, this is going to be the most common. And next, second most common is the malunion. And please remember, this malunion, because of this fracture getting dorsally displaced, this is going to give rise to a Diener folk deformity that I already told you. Okay, going to give Diener folk deformity. Another is Schudeck's dystrophy. It's basically a pain syndrome because of the sympathetic overactivity at the wrist. Okay, remember, non-union is very rare. The joint after fracture, okay, is going to, if it is going for non-union, then malunion will be rare. If it is going for union but it's not proper union, then malunion will be common, but non-union not. Means if there is a fracture and if this fractured segment has got healing potential, and if you correctly apply pop cast, so this will heal obviously. That means this bone will unite. But if you not apply the proper stationary if you not apply proper pressure here, or proper pop cast application is not there, if there is movement at this fractured segment, can lead to malunion. The union will be there, but that is not physiological union. Okay. But sometime what happens, this union, the bone has lost its union potential, so the bone will remain non-union, will remain in non-united form for a long time. So these two are very important thing: malunion, non-union. Non-union means healing has not occurred, so the fracture line is still visible. Okay. And malunion means there is no fracture line, but the healing is not physiological. This is not physiologically aligned. Understanding? So this is what you have to be remembering. So there is stiffness of the finger, there is Diener fork deformity, there is Schudeck's dystrophy because of sympathetic overactivity, and sometimes what happens, there is carpal tunnel syndrome because of the medial nerve compression. Okay. As I told you, Smith's fracture is also known as reverse Colles fracture because the distal segment here going ventrally. So this is giving rise to a garden spade deformity. Okay. This is giving rise to, you see, this is a garden spade deformity, and that was Diener fork deformity. Okay. So here again outstretched hand, but here wrist is inflection. Okay. There, see here, I told you this Smith's fracture, there is a fall on outstretched hand, but here the wrist is in flexion. Colles fracture happens, fall on outstretched hand, but wrist in extension. Okay, very important. Now here also you will be applying POP, or we can go for ORIF. Barton's fracture, I told you, this is ventral Barton, this one volar side is going, and this is dorsal Barton. Okay, the image and x-ray I showed you. Next is you can see here also that the Barton's fracture, there is disruption of this rim. This rim means the rim which is giving articulation to the carpal bone, so leading to subluxation of the carpal bones dorsally or ventrally. I told you this thing. And Schoffer's fracture, I also told you, fractured of the distal end of the radius, which is an isolated fracture. This is the handle which is used to start those engines. Okay. And there is a repeated trauma to the radial styloid process and leading to fracture. That is what is Schoffer's fracture.